and that's the right. So what you're seeing on the right is an abnormal liver. What you're seeing on the left is a normal liver. The reason why this is normal is you can see the vascular structures over here, and what you're seeing there is actually the contrast which has been excreted in the biliary system. So this is actually slightly delayed phase which has been taken following administration of the contrast agent. Whereas on this you can see the vascular structures are not clearly demarcated, and this is a cirrhotic liver, and you're not seeing the vascular structures swell, probably because of the abnormal perfusion in a cirrhotic liver. Again, I've got range of slides wherein you can see this is a completely normal liver. This is again, you can see that there are some septations where you can see these are reticular markings in an early cirrhotic liver. And if you see this particular picture, you can see some early nodules. So these are probably regenerative nodules in a cirrhotic liver. And as we move on, you're losing the vascularity in the liver again because of the abnormal perfusion. And moving on further, you can see a lot of nodules here. So these are all regenerative nodules. I'll tell you what's the difference between a regenerative and dysplastic nodules later on. And you move on and you can see that the liver loses the architecture completely. So what MR imaging techniques do we have? So there's been various contrast agents of late. We've used double contrast enhanced MR imaging, and the other advanced MR imaging is MR elastography, diffusion weighted imaging, MR perfusion imaging, and MR spectroscopy. I'm just going to brief you about what each of these actually helps us in advanced liver imaging. So this is a cirrhotic liver. This is not just a pretty picture. It also shows that there are a lot of nodules, and this is actually a T1 weighted MR image. In a T1 weighted MR scan, if you see a nodule, which is really hyper intense, that suggests that this could be a dysplastic nodule. Whereas on a T2 weighted image, a nodule is usually dark, and that's unlike HCC. In HCCs, what you see is the other way around.